Hi, everyone. Is that volume okay? It's hard to tell from back here. So, great day, beautiful sunny day. Thanks so much. I'm really, really honored to have this opportunity to talk to you about some of my ideas about disruptive innovation. So, the topic being very, very specific to the disruption and making the distinction that Todd mentioned when he gave his presentation about what is sustaining innovation versus disruptive innovation, and what exactly is it that makes an innovation disruptive in the first place. There we go. So what is disruptive innovation? Well, I can tell you what it's not. Any breakthrough that changes an industry's competitive patterns does not automatically mean it's disruptive. It's innovative, but it's not necessarily disruptive. There are 30,000 new products that are launched each year. About 90% of those fail. That's a big number. Does that mean there's lack of innovation? Absolutely not. But it may be that 10% is not disruptive. So there's different kinds of innovation, and each one of those types of innovation actually requires a different strategic plan. And I think that the word disruptive innovation is kind of tossed out there. It's commonly misunderstood and it's commonly misused. So when you misunderstand the actual philosophy behind the business model and how disruption actually takes place, it can lead to making less than optimal business decisions. So some basic premises about sustaining innovation. Sustaining innovation is designed to maintain the steady rate of product development. You retain your current market, you retain your current customer base, and you really respond to your current customers' needs. So you're very successful at fending off competitors, but it consumes most of your financial and human resources to do this. You eliminate products and services that do not meet your current customers' needs. So what this means is that you may become blind to new technologies in emerging markets. Sometimes those markets are not well identified, and you may not even realize that they exist. So speaking to the crafting work that provides a service or provides meaning can be particularly important. The basic premise of disruptive innovation is exactly this, as stated by Clayton Christensen. It's a process whereby a smaller company with fewer resources is able to successfully enter the market and challenge established incumbent businesses. So it's a very, very specific process. And here's how it goes. So the incumbents are focusing on improving products and services for their most demanding and likely most profitable customers. They exceed the needs of some of these segments, but they sacrifice the needs of others. They may ignore other opportunities coming up in the wings downstream. Entrants successfully target these overlooked segments and frequently at a lower price. So if you're creating something that's disruptive, you're usually doing it on a low budget. You're doing rapid cycle testing and getting feedback and making changes in a very rapid fashion. So incumbents, the existing large competitors, they chase higher profitability, and they don't respond vigorously to these incoming markets. The disruptors. Entrants move up market. They deliver performance that the incumbent customers may want, and then the mainstream customers start adopting this in very, very high volume. So Apple is a very good example of how this happened. The whole disk drive industry, cameras, Xerox, department stores, Sears and Roebuck and JCPenney losing their business to industries like Walmart. These are true disruptions. And the large established companies just didn't see it coming, and when they did see it, they couldn't respond vigorously or quickly or effectively. So some basic premises about disruptive innovation. When you create a disruptive innovation or you have a technology that's disruptive, you're probably going to sacrifice some of the performance that your current customers are accustomed to. What does that mean? You're offering a different set of attributes. Your current customers are not the people to ask about this. They're happy where they are. They don't want you to rock the boat. They're already being serviced and provided with optimizing strategies from you. So they're not the people to ask about new and upcoming downstream technological ideas. You need a low overhead for most disruptive innovations to have even a modest profit. And because you're not really clear on your marketing strategy, traditional processes of marketing and planning for your business model actually don't work in a disruptive technology. There are too many unknowns. So some of the challenges that we face when we use our traditional business models, and these are all tried and true, appropriate, well-developed strategies for managing a successful business. But we look at things like gross margin, we pay attention to unit pricing, we want to have a break even, we need to have ROI 40%, we can't go below that. Some of the operational costs, we look at end product quality, we want it to be way up here. Disruption is not there yet. Disruption is not designed to compete with your existing successful products. It's new, it's upcoming, and there are lots and lots of variables. So when we use these tried and true business models, we're actually missing out on an opportunity that may help us be disruptive. So there are some key steps that you can use when thinking about actual disruption. First of all is to determine the difference between whether or not your technology is sustaining. Is it a modified version or an improvement to something you're already doing just a little better? Or is it truly disruptive in the sense that you're creating a new market, you're creating a new application, something that's never been done before, or stands a chance of really kind of shaking the boat a little bit? Just define your strategic significance and what it is that you hope to accomplish with this. Observe and ask consumers in action. So again, your customers, your current customers are not the ones to ask about something that could potentially be disruptive. Locate the initial market. In many cases, it just doesn't exist yet or it hasn't been identified. So create it. Find a new way to provide a service or a product where it hasn't been applied before. Extend your purpose and brand. The whole idea is that if you're creating a disruption or you have a new technology that has the potential to be disruptive, it is not designed to compete with the large customer base that you already have. It's very, very distinctly different than that. So one idea is to prevent financial failures is if you have a large customer base, you're making a great profit, it's almost impossible to think about how you could dedicate human and financial resources to a disruption that's going to be put in a place to compete with your current product. So you do a spin-off or you create a completely separate entity so you can minimize your risk. So I'm an informatician, I'm a research scientist, I'm also a clinical provider. And I think that in my world, I have a very unique lens in that I get to observe lots of ways where there are ideas and innovation can take place, and some of those innovations can actually be disruptive. So it's not just in the processes of healthcare delivery, but I also get to observe providers, patients and their families, workflows, and the processes of actually delivering care, how we use our technologies. I look at outcome measures, patient engagement, and I also look at the actual needs of what our technologies can provide and then compare that to how users actually use the technologies that we provide. And there's often a mismatch. So between research and trends and establishing what the needs of clinical users and patient and family users and system users may be, I get a chance to see a lot of stuff. So here's a personal case. I'm also an entrepreneur. No, that doesn't make me an oddball. But this is one of my companies that I developed, and I'll kind of give you a little story about the process. It was based on a randomized controlled trial where there was very significant findings in reducing hospital readmissions and visits to the emergency department. This is before the curve of care coordination, and bundled payments. So this is kind of early on now. Now that is not the case, but at the time it was ahead of the care coordination curve. It was very innovative, inexpensive, intuitive. But what I realized was the only people that benefited from this intervention were the people we enrolled in the randomized controlled trial. So looking at all the things I could possibly learn from this research study, which is well published, I went back to the drawing board and decided to build a scalable system that could actually be commercialized and used for patients, regardless of whether or not they were in a controlled research study. Because of that, self-funding was possible. That's a big risk. It was kind of scary, because I'm not a serial entrepreneur. I'm a nurse research scientist who does informatics, so this was a big gamble for me. I took a step back from my university and developed this company. So the team was extraordinarily diverse, ranging from professional project managers to clinicians like myself, but also technicians, and we had attorneys on the team, visual people, to help me with this process. And we did very, very rapid cycling using an iterative process. So we went from this to this to this to this. This was the final product. And then we decided to create this little tiny
healthcare costs
30-second
continue to
demo.
rise to unsustainable levels. All healthcare organizations are under pressure to improve quality and enhance the patient experience while reducing costs. IVR Care Transition Systems provides proven solutions. By targeting your major cost drivers, including preventable hospital readmissions, emergency room visits, and the allocation of clinical resources, our tools are designed to support patient engagement at all levels of care by providing clinically relevant information from patients to providers at the right time in the right format so that early intervention can prevent an urgent medical crisis. Our automated, cost-effective system for patient follow-up includes patient-reported outcomes, data capture and analytics, clinical documentation, and communication links to external providers for less than $1 per patient per day. Call us today to schedule a demonstration and take advantage of our 30-day free trial. IVR Care Transition Systems, reducing your costs while improving patient experience.
So the idea behind that is that we focused on a very, very specific market, and that was the patients who are transitioning away from clinical settings and moving back into the home. So what's the outcome? Well, 20 months, initiation to exit strategy. I do have, we were able to put a process patent in place, so it's not a product patent, but a process patent. So the company was sold to an Atlanta-based firm called Sequence Health in January of 2015, and they integrated the product into their existing platform, and it's doing really well in the marketplace right now. So I'm very, very lucky. That was not a disruptive technology. It was innovative, but we were not quick enough, and we were not ahead of the curve enough, and lots of competition began to emerge into the marketplace. So as soon as larger entities saw what we were doing, they actually did respond, and they responded vigorously and came up with other products to compete with this. So they responded to the threat. So this was not, it had the potential to be disruptive, but it really wasn't disruptive in the true sense of the word. Does that make sense? Trying to make that distinction. So the lessons learned: work quickly, work in tandem. This is not, a disruptive technology development is not a linear process. You can't use the waterfall method. It doesn't work. It's not fast enough. It's not flexible enough. So you have to work in tandem and have all the systems going at the same time with constant iteration, really good team cohesion, a unified vision, and a dynamic process. Over-communicate at every single opportunity that you have with your team to stay on track. Listen, observe, listen some more, observe some more. You can never do too much of that to actually learn the value of what you're trying to put together. And recognize good opportunities with the caveat that all opportunities are not necessarily good ones. And you can't be risk aversive. You got to be willing to take a chance. And by not investing or overcommitting to your process and being flexible, you can actually do that pretty well. I would like to propose that the potential for innovation that's disruptive is right now. And here's why. So we have EMRs that are well established. Our users of those EMRs are not novices anymore. They've got some experience under their belt now. So they're not going from paper to electronic format. In many cases, some of those systems are reaching the end of their life and they're doing re-implementations with newer and better products, and our users expect it. So they're not novice. We have great integration capabilities, some of which we've heard about throughout today's conference. We have security capabilities in place now, which we did not have when we first initiated EHRs. We had to learn that process and get it done. And there's a value-based curve that's driving active patient engagement and providing reimbursement for the use of our technologies, even in remote locations and applications now. And that never used to exist. So this is a very positive sign that this is the perfect time to think about disruption coming upstream. And our patient population and customer expectations, they are tech savvy. They expect rapid results. They want to use technologies. So I propose that this is what's happening now. We have incumbents that are focusing on improving products and services for their most demanding customers and their profitable customers. Right now, this is what's happening. They're exceeding the needs of some segments and ignoring the needs of others, happening right now. And they're chasing higher profitability by making their existing products better. And this is exactly why it's the perfect storm for disruptive innovation to start coming in way downstream. And I propose that the next wave of disruption is going to move away from this, which we've all seen, and move toward this, using something like this. This is my latest prototype. Her name is Audrey, and she is designed to go home with patients and support them by collecting physiologic data and transmitting that to clinical providers during a clinical encounter so that you have a visual and you have your speech. You're talking to the patient. She will do voice-to-text note-taking, so you just edit, sign, and go. But she also has a camera that can allow you to zoom in and look at a wound, or can pan out and have the patient show you how they're using their walker or assess their mobility or safety. Why is Audrey special? She's just a computer that looks kind of cool, because patients designed this with me. They sat down and said, this is what we want, and they named her Audrey because it embodied Audrey Hepburn, I think, someone that's caring. So it's a technology in the home, but it's not scary and high-techy. And that's just to show you scale to size. Anyhow, it does. So that's Audrey. Some things to consider. Be a keen observer of trends and opportunities. And I think that the timing is now to start with some disruptive innovation coming into the marketplace. So the 4 steps are some basic steps. Disruptive or sustaining, you have to make that determination. Either one is okay. Not all innovation is designed to be disruptive. But if it is, you need a different business model to be able to support that work. Just define your strategic significance. Locate your initial market. If the initial market isn't readily apparent, create one. In this case, it's the patient in the home and their external family members who can participate in the visit remotely. Create an independent entity to develop your innovation and your technology, and then experiment with rapid iteration and keep it inexpensive so you can lower the risk of that disruptive technology. So I'd like to thank you so much. And I'll close here, and I think we'll do panel now, right? Ah.